So I have taken sort of a circuitous route to ultimately child psychiatry. So started with pediatrics, and I completed that residency a year ago now. And it was really during, although I had the inclination that I wanted to do psychiatry, it was really during my pediatrics training that I decided to pursue child and adolescent psychiatry. And that was primarily because I was seeing so many patients in the outpatient general pediatric setting that really needed more access to mental health care, and it just wasn't possible due to lack of clinicians in the area. And knowing that that kind of need was nationwide, I felt like sort of directing my education efforts that way was probably the most fruitful for the patients that I wanted to serve. So that's how I came to the realization to pursue child and adolescent psychiatry, and by way in which I'm doing adult psychiatry first. So just finishing up my first year of that training. So I really enjoyed being a member of the clinical educator track here at UW, and that was one of the big draws for me for the psychiatry training program here, was that they did carve out time and devoted that to people interested in pursuing an educational role down their career path. And so I really enjoyed being a part of that by way of having dedicated time each month with people that have become really kind of stars in their career by way of education to upcoming medical students and residents. So really fortunate to be part of that. And based on my past training, being a pediatrics resident, felt like really directing my efforts towards other pediatric residents was probably the best use of my past experience. And so far, what we've been doing is I've been participating in morning reports for the pediatrics residency program. I've given a couple of those this year, and I think they've been really well received, and the pediatrics residents are really hungry for the knowledge of mental health care for their patients. We know that right now there are no requirements by the ACGME for pediatrics residents to have any specific mental health care training, and so that's a pretty significant identified need for those residents. The way that we see that this project, or that I see this project evolving, is that this coming year we'll have dedicated conferences to just mental health care issues for as they pertain to general pediatricians. So we'll have a 4-hour conference, hopefully co-led with one of the other faculty within the child and adolescent psychiatry department, on depression and anxiety for general pediatricians. So that's sort of where we see this heading. Hopefully it will become part of the actual pediatrics residency training program, so that even after this year it will continue to perpetuate in the years to come. So after all of this training finishes, what I really hope to do is to find a good blend of pediatrics and child and adolescent psychiatry. And while I think my inclination is to practice solely child and adolescent psychiatry, I would like to do that in a pediatric setting. So my ideal practice would look something like being kind of a consulting child and adolescent psychiatrist to a group of general pediatricians, really looking for an integrated primary care model, which I know the University of Wisconsin is really embracing and moving forward with, to find a medical home where patients can come and see both their general pediatrician as well as somebody that can offer them mental health care in one setting, in a setting where those providers are really collaborative and working back and forth for the best of the patient.